Our first order of business in healthcare is keeping patients safe from harm. But despite the best efforts of clinical teams, medical errors and complications of care are common. Extensive research has been devoted to understanding medical complications, including healthcare-associated infections, or HAIs, and their causes. But how do you apply that knowledge day in and day out on the front lines of care? To answer that question, the Agency for Healthcare Research and Quality developed an intervention using a comprehensive unit-based safety program, or CUSP.
CUSP is an approach that helps clinical teams provide safer care. It combines clinical best practices with an understanding of the science of safety and improved patient safety culture.
CUSP is a customizable program that uses communication, teamwork, and leadership to create and support a culture of patient safety.
In my 32 years as a nurse, the CUSP program is the most powerful program I have ever seen.
Using CUSP, clinical teams across the country have significantly reduced infections in the sickest patients.
Historically, frontline caregivers, especially nurses, have not been included in safety programs. The CUSP turns that model on its head, and it empowers the frontline caregiver to make a difference. During the last 31 months, we have not had a CLABSI in our entire facility.
Well, I think it worked because it was led by frontline doctors, nurses, and administrators working as part of a CUSP team, believing this was their problem and knowing they were capable of solving it. It worked because it was informed by science, and it worked because it aligned many groups around a common measure, each doing their part to eliminate these infections.
The toolkit, developed based on the experience of the national project, gives doctors, nurses, and clinicians tools to understand how to identify safety problems and gives them tools to address these problems.
But I really want to emphasize the profound impact that's the heart of success of CUSP, and that is the shift in our thinking from it was actually possible to eliminate something that we had come to view as inevitable.
Now is the time to join the thousands of healthcare providers who are using the CUSP toolkit that will also help you instill a culture of safety within your own institutions.